Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Giep. He is a neonatologist. I've been practicing that. Did I get that right?
Yes.
Neonatologist.
You did good.
All right. So let's talk about what you do here at East Cooper Medical, being a neonatologist, right?
That's correct.
What do you do here?
Well, a neonatologist is a pediatrician who's gone through extra training, 3 years extra training to care for sick newborns and premature babies. So we take care of all the sick babies here at this facility.
Because this is where babies not come from, but you have a lot of babies here, right? I mean,
well,
East Cooper's known, this is the place to be to have a child, right?
Well, yes, it is. We have a wonderful team here that will take care of your baby. If your baby is sick, obviously we have a team of neonatologists, nurse practitioners, as well as neonatal nurses that are highly trained and specialized to take care of these babies. And we're available 24/7 here to take care of any needs that the babies may have.
So I always have to ask people this, why they decided to get in this area or this specialty of medicine. And you deal with a lot of children, obviously, and parents and things like that. Why did you decide?
Well, it's sort of a long story why I decided to go into neonatology. My dad's an OBGYN, and I'm the oldest of 4 boys, and he wanted all of us to be OB-GYN because he thought it was the most wonderful career ever. And so when I decided not to go into OB-GYN, he was obviously very disappointed and would not talk to me for 2 weeks. And finally, when I did my pediatric rotation, I felt a calling to become a neonatologist because I like to do procedure. I felt that I was good handling stressful situations, and I like intensive care. And it's something you have to have inside you that you can take care of not only the sick baby, but also the needs of the parents and explain what's going on with the parents about the baby and be able to explain it in a way that a layperson can understand.
What do you find is the hardest part of your job? Obviously, I would think maybe telling a parent not so good news.
Yes.
But you would have to have great bedside manner and things like that in order to communicate that to people during a stressful time.
In med school, they don't teach you good bedside manners. They don't teach you communication. I mean, they try to, but these are things that you learn as you go through your training as well as in real world. Being a neonatologist, the clinical part, you've gone through the training, you should be able to take care of a sick baby, but there are things that they don't teach you, like how to present yourself. And so the toughest job I have is, you've got a mom who's had a baby, they spent 8 or 9 months anticipating this wonderful bundle of joy, and the baby comes out and there's some issues, and I'm the bearer of bad news. I have to come in and talk to the family, tell them this is what's going on with your baby, that's, and these are the complications, these are the potential outcome that may and may not be good. And I have to break this news. So I've got 5 minutes to really come in, talk to them as a complete stranger, and really make them understand that what's going on and so forth. So it's a tough job.
Wow. And I'm assuming that having a strong team along with you is very important as well, right?
Yes. Having a strong team that can do their job and also reinforce what I say to the parents. And that's why, in the mornings we all have like a multi-specialty rounds in which, we have lactation here, we have speech therapy, we have social service, we have the nurses, and we have respiratory therapists. We all get together in the morning, hopefully with the parents there, so that we can do rounds. And at these multidisciplinary rounds, we we talk about their baby in front of the parents so that parents can participate in the care of the baby and know exactly, number one, who's on the team and what's going on and what's everybody's responsibility and what the plan is for that day. So they can't, go back and say, I've never seen a doctor, I can't get a hold of the doctor, I don't know who my lactation consultant is, I don't know who my speech therapist is, because all these specialties are required in order to work on the baby and get the baby home. That's our ultimate goal.
So let's talk about the nursery. I've never even thought
Yes.
about a nursery in a hospital. I thought it was just a stopping point before they go out the door. But what makes it special?
Well, our nursery not only has special nurses and special team, we're highly specialized unit for this entire purpose. And so the nurses have a lot of years of experience. They've come from tertiary centers to work here. But if your baby requires something more highly specialized, then we do have an affiliation with the Medical University of South Carolina. And so those babies do go downtown, especially if they need like open heart surgery or surgical issues or something that requires a subspecialist.
So before we head out, as far as success stories go, there's a lot of promise. Obviously, there are probably situations you can't change or anything like that, but with advances in technology and things like that, the success rates are much higher now, right?
Yeah, the success.
When premature babies and things like that.
Success rate is a lot higher now. There's a lot of new technology. There's a lot of new treatments. But one thing that they can't replace is the human touch or the bedside manner that we talked about. One of the things that East Cooper has that a lot of hospitals don't have is what we call the rest easy room. So every mom that has a baby in our level 2 nursery is assigned a room where they can keep and stay there until the baby gets discharged.
So y'all are thinking about it from all different angles, right?
Absolutely. Like you said, the clinical part is the easy part. It's all the other parts, because the family unit is basically a unit. So if a baby is doing well, but mom is not doing well or dad's not doing well, then the entire unit is going to fail. So we pay attention to the mom. We alert the OBs if there's any postpartum depression that we see. So those are all issues that we focus on. So not just on the baby, but the entire family.
Wow, you got a big job.
It is a big job.
Alrighty, well, thanks again for being with us today.
Well, thank you for having me.
And for more information, you can always head online to eastcoopermedctr.com.